The original eczema that people call eczema is not eczema. Usually I always tell people. It's actually called tinea versicolor. And that's very common in our environment.
You're listening to Asharami Radio.
Today we're bringing you all the hot gist and the best tips to have that glass skin that you were dreaming of in Santa wish list. Well, today we have Dr. Folakemi Cole-Adeife. And Dr. Folakemi is a consultant physician, dermatologist, and venereologist, apologies, at the Department of Internal Medicine of the Lagos State University Teaching Hospital, Ikeja, and an associate lecturer at the Lagos State University College of Medicine. She's a graduate of the College of Medicine, University of Lagos, a member of the West African College of Physicians, and a fellow of the National Postgraduate Medical College of Nigeria in Internal Medicine, subspecialty dermatology. She also has a diploma in tropical medicine and hygiene from the London School of Hygiene and Tropical Medicine, and a master's in public health and health promotion from Brunel University, London. Folakemi is an active clinical researcher working on various areas of research in medicine, dermatology, and public health. She's a skin health advocate and frequently engages and educates the public about good skin health practices and the dangers of skin lightening on radio, television, and various social media platforms. She was recently awarded the 2025 Young Dermatologist International Achievement Award for the African region by the International League of Dermatological Societies for her contributions in advancing skin health in Africa. Well, I haven't read all of this. If by now you don't feel safe knowing that your skin is cared for with my guests, I mean, nothing else can do it. Well, welcome to the show, Mrs. Folakemi. It is such an honor and a privilege and an absolute joy to have you here.
Thank you so much.
I'm going to take this as an opportunity to say that the next time you guys see me and I'm glowing and I come out with that glass skin we talked about, this is where I got it from. So you definitely want to be tuned in. This is the time to get those jotters and your pen and your paper, everything that you need to gather as much information about the skin as you can. What is the primary function of the skin as an organ?
Yeah, so you've already spoken quite a bit about it, and I love the fact that the skin is getting the attention that it's always should have had as an organ, because most people don't think of the skin as an organ, but it is. It's the largest organ in the body, as we've spoken about, and it's the only organ you can see. You can't see your liver, you can't see your heart, your lungs. So even if something is wrong with it, it's hidden. But everybody can see your skin. So your skin is your ambassador. Your skin is what represents you. Your skin is what everybody knows about you. And your skin is also a window into the body. So it's not isolated. It works together with all the other parts of the body. And a lot of times when something is wrong, it shows on the skin. And also when you're doing things right, it shows on your skin. Not just as regards to skincare, but as regards to your general health and well-being. So the skin is really, really fantastic. And
haven't heard all this. I feel like the skin is about to run a campaign because it's doing a lot. It is doing a lot.
Oh, it is doing a lot, but it's very protective as well.
We're getting there. We're getting there because to achieve all of these functions, the question now is, how do you do that? So can you take us a little bit into the layers of the skin, what each one does to help us achieve this?
Right. So our skin has three main layers. The outermost layer is what we call the epidermis, and that's the layer that everyone can see. And also, that's the layer that is the most protective, because the cells in the epidermis are dead, actually. They're like hair cells, but they form this bond. They're like transformers unite, So they are shielding, they form a cover, they prevent, bacteria and too much of, toxins, or a lot of things are not meant to penetrate into the lower parts of the skin. They keep them out. And then you have the second layer, which is called the dermis. Now, the dermis is the powerhouse of the skin. That's where a lot of the work takes place. That part of the skin is alive, and it has blood supply. It also has it produces a lot of things that it then pushes out into the epidermis. However, in between you have your melanin cells, which is at the lowest part of the epidermis. And that's what, paints the skin basically. So if you look at the melanocyte that produces color, it's kind of like a paintbrush, and it's literally just sending out paint or color into the upper parts of the skin. And so everyone has their own unique color and skin tone, which is a combination of the melanins they have. And so that's why we're all uniquely beautiful, and we all have, human beings have millions of tones of skin color, and they're all uniquely beautiful. And then in the dermis, you have collagen that keeps the skin plump. The skin is, it gives you, the youthful look. So that's why as we get older, that part tends to kind of reduce a bit, and you have the blood flow. Then underneath, you have the cushion, and that's the subcute or hypodermis where all the fat is. And so the subcute is kind of like a cushion layer. So it cushions the outer skin and also gives a bit of plumpiness, and it also cushions what's underneath. And all these layers of the skin work together synergistically to protect you, to give you your beauty. And in addition to that, the skin actually helps with temperature regulation. So there are some glands that produce sweat. There are also some glands that produce oil in the skin. And, there's also the production of vitamin D. So when the sun's rays hit the skin, it activates vitamin D in the cells and makes vitamin D useful for the body. So it does have so many fantastic functions. And then touch, of course. So you know that you have sensation, there are nerve endings on the skin, and that kind of helps us, warns us when we're going into the danger zone with pain, and also helps us to have pleasurable sensations, which as human beings we all love. Loving touches, as they call it.
Oh my. Well, if you knew this before, congratulations to you. Right now, I am wondering how I'm going to map out that organogram in my head, because that is a lot of layers, and each one is so functional. You
And-
can't take it out.
And each of these three layers have their own mini layers. So
Okay.
like the first layer has 5 layers in that one.
You know
The
what?
second has 2. So there's still many more
I'm
layers.
sorry
So
to
it's
cut you, but
amazing.
anybody that wants to know more than I just found out will have to reach out to you, because we're going to have to move on.
Sure.
But, having heard all of this, it creates that sense of consciousness to say, okay, what am I to look out for? So I'm asking now, what are the common skin conditions, and like, how do I prevent them, or did I say protect my skin from them?
Okay, so the first thing is, I always tell people, is to take care of your skin. If you take care of your skin properly, you're less likely to have certain skin conditions. There are some skin conditions that there's nothing you can do about. And whether you take care of your skin or not, they may occur because of genetics, because of, things like that. But most skin conditions you can try to prevent or manage if they come early. So care of the skin starts from within. It's not about what you put on your skin primarily. It's about what you put into your mouth. Yes.
I just
So-
remembered all my skincare friends. But it's all right.
So yeah, skincare is absolutely fantastic and important. But you see, if you're doing the best skincare routine and you're eating junk food, I always say it's like putting water in a basket. It has to complement your skincare routine should be complementary to your diet and your lifestyle for you to get the best skin that you want. So the skin does not function in isolation. As I told you, it's a window into the body. So if your body is healthy, your skin will be healthy. And sometimes the things that occur on our skin, the common skin condition, as you mentioned, acne is very common in 80 to 90% of people will have acne at one time or the other. We all had our bouts of acne. I beef the few people who never had acne.
I do too. I do too.
Yes, but most of us don't fall into that category. Now, that's one of the most common skin. Another very common skin condition is atopic dermatitis, atopic eczema. It's something that occurs in childhood. The skin is sensitive and dry. And then you have things like psoriasis. You have things like fungal skin infections. So now the original eczema that people call eczema is not eczema. You should always tell people. It's actually called tinea versicolor. And that's very common in our environment. People have, some people say, I did your back like eczema. Have you heard that before? I heard it once and it was so funny to me. But that's not eczema.
You guys better not say that to me again. Just putting it out there.
So it's tinea vesicola. It's very common in our environment. And then in our environment, we also have a lot of hair related issues. The hair is an appendage of the skin. So it's an extension of the skin. And so, and then people tend to have fungal infections in this environment. And most of those fungal infections are driven by certain skincare practices, which I can also talk about. So a lot of these skin conditions, well, sometimes you have a genetic tendency, but how you deal with them or how you can prevent them from becoming really severe depends on how you take care of your skin and your body. And a lot of new studies have shown that diet plays a major role in managing that. So, diet, lifestyle, and then a good skincare routine. And before I leave here today, I must give my pearls on how to have good skincare or a good skincare
I told you
routine.
guys I was gonna have glass skin after this. You didn't believe me. Now you've heard it from Folake. Well, but for I'm gonna have to take you a bit back.
Right.
When you just told me now that eczema that I grew up knowing as eczema is not eczema, and I am still in a bit of shock.
Yes.
But to help me and my fellow group members that are in the same school of thought, what are like the common misconceptions with skin, and just give us some of the myths that we should look out for when we
Right.
hear them. We're able to say, oh no, this is a red flag.
Right. So the first thing, which I believe is a myth, is that a lot of people believe that your skin has to be squeaky, completely clean and sterile. And so you find a lot of people using antiseptics, disinfectants. Mothers will tell you they want to kill all the germs on their children. This is a misconception. This is a myth because our skin has healthy, good germs on it that have a role they're playing. They have a function. Where the skin is not meant to be sterile, just like the gut. There's healthy bacteria that even help us to digest some food. And then the female reproductive tract as well is meant to have some healthy bacteria that keep it healthy. And it's the same with the skin. So when you're overusing all these antiseptics because you want the person to be completely clean, you're actually doing more harm than good. And that's something that is very hard for a lot of people to hear. When I talk about it, I get a lot of pushback. I'm like, it's the truth. Because those healthy bacteria, they're like, think of them as tenants. You're a landlord and you have good tenants. Those tenants pay rent, they help you take care of your property, they don't trash it. And then you drive them out and you don't lock the door. What do you think is going to happen to that property? You're going to get freeloaders, riffraffs coming in from the street, damaging the property and all. And that's what happens when you use antiseptics on a daily basis on your skin. And this is one myth that is very common. And I think another myth that people have is that, oh, if I'm fair, I should have a specific skin cream. There's cream for fair people and there's cream for dark people, and that's not true. Your skin care should be based on the kind of skin you have, whether it's oily, whether it's dry, whether it's sensitive, whether it's combination skin or normal skin, and not the tone. Like I can use the exact same skincare product as a white person who has the same skin type as me. I have oily skin. So if my skin is oily, if I stay here for 2 hours, my nose will start shining. And if I don't take off the oil because I have oily skin. And some people have dry skin. So your skincare products should be based on your skin type, not your skin tone. That's another misconception or myth that a lot of people seem to have. And then some people believe that lighter skin is more beautiful. Absolutely not. All skin colors are beautiful in their own way. And so everybody should embrace their skin tone, whether it is ebony black or ivory white or anywhere in between. And these are a lot of the myths and misconceptions that we find in our environment.
I mean, having been called beautiful by a dermatologist, you guys should know that
You're
the moment.
beautiful.
Oh no, I'm gonna come in with my shoulder parts just inflated in case you guys didn't see that.
Yeah.
But today I've heard a lot about the balance between what I put into my body and how I expect my skin to look. So what exactly should I do in terms of diet and lifestyle?
Absolutely. So the negative things, let me start with first. Sugar is number one. Sugar is a problem. Sugar has been high glycemic foods has been associated with so many problems, including aggravating skin conditions. So if you are a sweet tooth, I would advise that you maybe tone down on that a bit. So the fizzy drinks, the ice cream, the brownies. I love brownies. I love chocolate. but I've had to really cut down on that because I know that it's they're not the best for the health. So that's it. I'm not saying don't take it at
Mm.
all, but moderation is key and try to minimize as much as possible. Then also you want to eat foods rich in fruit. You want to eat foods rich in vitamins, minerals, fruits, vegetables, healthy fats. An example of a healthy fat is avocado or fish. They contain fats that have omega 3 fatty acids that are very healthy for the skin and the body, the heart, and other organs. So that's very essential. You also want to drink a lot of water. That one they say drink water and mind your business is very true. Drinking water is good for the body and including the skin. It alone is not going to solve your skin issues, but it's going to
Well, at
complement
this point,
that.
I have a bit of mixed emotions because tell me how I'm going on a date and I'm not having ice cream to my full, or I have to be cautious about
You
it.
can do fruit sorbet. There's always a healthier option.
Well, I mean, there's that, but I do have to ask, like, so now beyond the diet, speaking to external factors now,
Right.
what's your take on the construct that skin is an expression? So we're tanning, we're tattooing, we're having external impact on the largest organ.
Absolutely. So the skin is also a work of art and also is
Mm.
a canvas for a lot of people, particularly for our makeup people. I love makeup artists because they're able to paint the skin and do so many fantastic things and, just make you look. And it's also part of self care because self care is important. But beyond that, everything we do should be done with moderation and with caution. For instance, with makeup, I can't count the number of people that have come to me after makeup having breakouts, maybe because of the hygiene and things. So when you're doing makeup, make sure you insist on proper hygiene. Then tattooing. I recently did a video on tattooing, which was trending on TikTok because it spoke about the risks of tattooing. Tattooing is fantastic, it's beautiful, it's self-expression, but you must be cautious where it's done. Hygiene is important, and people have gotten infections from tattoos. So that's the thing. And then there are some new studies coming out too that are saying tattooing may be associated with increased risk of certain cancers. So we just want to be cautious. I haven't spoken about the skincare routine yet, but I
You know
mean, I
what? Let's
think
just go
we'll,
straight into that because I was
yeah.
going to ask you now that I know that everything has to be done in moderation, I can accept that. So the
Mm.
question now is what routines, what do I do when it comes to my skincare? What am I supposed to do and not do? And I even hear that there's a time that I'm supposed to do certain things and there's a time that I'm not supposed to. But now that you're here, I'm sure we're going to have
Okay.
clarity.
So let me start from there. The first, there are 5 steps I always talk about with skincare. The first 3 are essential for everyone. The other 2 can be optional. So you want to cleanse, you want to moisturize, you want to protect, of course. So those are the 3 important parts. A good cleanser. I often recommend pH balanced cleansers and not soap because soap is very highly alkaline and our skin is acidic. And so you're better off using a cleanser close to the pH of the skin for it to if work
Yeah.
optimally.
Okay.
Secondly, you want to moisturize. So moisturizing your skin with moisturizer based on your skin type. If you have dry skin, you want to use something that's more oily, and if you have oily skin, you want to use a moisturizer that's more water based. So if your skin is always shiny, a water based moisturizer is probably better for you. If your skin is always feeling dry and tight, you want to use an oily or cream moisturizer. And then protection. Protection means sunscreen and antioxidants. So it's so protection is sunscreen is not limited for white people or light skinned people. Everybody needs sunscreen. It's more important for white people or people with albinism because it protects against skin cancer. For us, the melanin in our skin kind of is very protective against skin cancer, and so we don't get skin cancer as much. But we get something called photo aging, and the sun can cause photo aging, aging of the skin, wrinkles, hyperpigmentation, and so sunscreen protects against that. So everybody needs sunscreen, and I would recommend in this part of the world, in Nigeria, SPF 30 and above. In temperate regions, SPF 20s and above is fine. So that's sunscreen. Then the other things is exfoliation. You want to use exfoliants. Exfoliants kind of help to peel off dead skin or dry skin, and that's also helpful. And then the last thing is antioxidants like vitamin C. You have things like that. Vitamin C is a very good antioxidant. resveratrol, ferulic acid, so those things help. So the 5 steps are okay. Not everybody needs 5 steps, but everybody should do at least the first three: cleanse, moisturize, protect.
Well, you have answered. I was going to ask the audience to send in some questions, but I see that you've even answered some because somebody had already asked to see, I'm black. Do I really need sunscreen? And you have answered that. But we also have some more questions here, and I'm
Go
going to
ahead,
read them
sure.
out before you
Mm-hmm.
to respond. So this person says, I've had this clearly darkened skin for many years now, only on my face with the exception of my bicep area. I've tried many sunscreens with no improvement. I've not used any skin lightening products, no bleaching at all. What can I do and where can I get a professional consultation?
Well, if you have some hyperpigmentation that doesn't seem to be going away, the best thing you need to do is see a dermatologist. Let them assess your skin, let them examine your skin and see what kind of hyperpigmentation it is. Sometimes, if it's a very deep form of hyperpigmentation, you may need not just topicals but certain procedures to get rid of the darkening. And then we also need to look into things like if you're on medications, your diet. Are you doing anything that could be adding or contributing to that hyperpigmentation? So, a full consultation is usually important in instances like that. You can see a dermatologist in most specialist hospitals. Yes, and if you're a Sahara person, you know where to find the best hospitals in Nigeria to see a
Well, I mean,
dermatologist.
at this point, I'm sure your bio is about to become popular, but somebody is also saying, is it okay to use sponge every day when bathing?
So this is another controversial issue. I didn't want to raise it here because every time I raise it, some people are always trying to beat me and say, "What do you mean? Our mothers have been doing it," but it's absolutely not. It's not essential. I don't use a sponge. I have itchy skin when I use a sponge. Sponges are not necessary. The soap and a good cleanser will do the job of cleansing. But I think it's more cultural. Some people have grown up with it, they've gotten used to it, and they can't do without it, and that's fine. So if it makes you feel good, please by all means go ahead and use your sponge. Don't use it every day if you can man without it because it dries out the skin. Like remember I told you the skin produces healthy oils. And
Yeah.
when you're scrubbing it morning and night, you're taking off all those healthy oils. You may get away with it when you're young, but when you're older, you start seeing the adverse effects of that. Your skin might age a bit faster, it gets more itchy. And so I wouldn't recommend using a sponge every day. Three
Well,
times a week, yeah, if you must. If you have itchy skin, just ditch the sponge. You'll be fine. You'll be clean. Do I look dirty?
definitely not.
I don't use a sponge.
Well, you heard it
Okay.
here. But speaking of culture, we have someone here who seems to have brown sugar in their culture. Says she acknowledges that you have said that the sugar is not too good. Says, but what about brown sugar? I feel like the brown in the sugar somehow contributes to my melanin. Speaking of the dark skinned ladies,
um,
says don't take away my brown sugar from me. What about brown sugar?
Brown sugar is sugar.
Hey.
Honey, even honey is high glycemic. It's not as it has the same amount of what they call the same glycemic index as sugar.
Okay.
So some people say, "Oh, I don't eat sugar, but I only do honey." Auntie, uncle, it's the same.
Take your
So I always say do moderation. Don't I'm not saying take out everything, but like if you put 3 spoons in a cup of tea, maybe you can reduce it to one. You know, just be moderate about
Okay, I'm going to take a quick one through the rest of the questions.
it.
Somebody says they do not use cream at all. Nobody cream. Is that fine?
It's fine if your skin is healthy and it's fine if your skin is not dry or itchy. I always say don't fix what is not broken. If you are not is using a cream is not the most important thing. But as you get older, your skin may produce less oil. Generally our skin ages as we age. And so even if you don't use a cream now as a young person, you find that when you get older your skin may become a bit drier, so you may need to use a cream. So if you're good at the moment, please by all means enjoy. But if you begin to notice your skin getting dry or itchy, please, you may need to start moisturizing at some point in the near or distant future.
Moisturize in moderation as required.
Yes.
So we have another one. I'm going to make this one a quick one because we do have to speed up at this point. But this
Okay.
person says, do I really need to use cream when I excessively sweat? I guess at this point, the moderation covers for that. And we have another one that says, what's the best way to deal with tinea versicolor that pops up randomly?
Yeah, so tinea vesicular. Thank you for using the right term and not eczema. I'm happy. I think I've I've achieved something today. So tinea vesicular, you can treat with antifungal washes. They are over-the-counter antifungal washes. It's caused by a fungus that lives on our skin naturally but tends to overgrow. So what we do is use an antifungal wash to try and reduce the load of that fungus on our skin. So I don't think I'm meant to call any brand names, but if you go to a pharmacy and you say you'd like an antifungal wash. They're very common ones that they can give to you. And most of them come as shampoos, which is okay because dandruff is also caused by this yeast. So the most of the treatment for it is made in form of shampoos. But you can use that as a body wash if you have tinea vesicular on your face or your back or your chest where it usually likes to come on.
Well, I'm going to take this question as the last question. So, somebody is asking, what is your opinion on using shea butter and essential oils?
Oh, I love shea butter. Shea butter is absolutely amazing. It has so many healing properties for the skin. It has omega-3. It has a lot of fatty acids that are healthy for the skin. My concerns with shea butter is how it's produced because a lot of it is produced locally with people who don't use clean water. They boil the shea beans under like a firewood, and some of that contaminates the shea butter. So we did a study analyzing various shea butters, and a lot of them were contaminated with hydrocarbons. And hydrocarbons are harmful to skin. So if it's properly produced and manufactured, it's absolutely amazing for the skin. And a lot of new international brands now incorporate shea butter into their creams. But if you want to use shea butter, ensure that it's well produced and well packaged. Don't just buy shea butter that is on the road, on the streets, because it may be contaminated and the contaminants may actually cause more harm than good. Essential oils, a little bit, I'm not too much of a fan of because some of them are irritating to the skin. You want to use them very sparingly, and then please don't use them on children. Some essential oils are endocrine disruptors, things like I think lavender and even tea tree oil that's quite common. You want to use it in moderation, very little. Again, I'm a moderation person. If a little bit of anything will not kill you. It's when you go overboard that it starts to produce problems.
Well, I'm going to take that as a response to every other question we have in the comments speaking to exercise. And those someone who has suggested that using sweat as a moisturizer is applicable. Once again,
well, I would say exercise is fantastic for the skin. I love to dance, and I think working out a sweat helps take out, sweat, and it does moisturize your skin, but you don't, because it's when it gets onto the skin, it can get contaminated, so you want to wash it off. But yes, sweating is great for the skin. Exercise is good for the skin, and you want to do them as well. You want in your lifestyle practices, and then avoid pollutants. That's one thing in the environment. You want to try to minimize exposure to pollution. It's difficult, but you want to just be conversant of that. And that's where antioxidants come in because antioxidants help to combat the effects of pollution. Yeah.
Well, while a lot of people have taken this as an opportunity to speak up, I really do appreciate every single person that decided to comment. Some are definitely probably going to find you, via social media after this.
Yes.
But for those of you who were like me and took notes and decided to take advantage of having how to get a glass skin at this point. I keep emphasizing the glass skin. I have to have it. I really have to work.
If you follow those 5 steps.
I really have to work on it.
Cleanse, moisturize. What's the next one?
There's protect.
Then exfoliate and use antioxidants.
Okay.
You do those 5 things. Trust me, your glass of beautiful skin.
Woo!
Tune in to Asharami Radio this Friday and every other Friday. Asharami Radio. You're listening